everyone, greetings of the day. Hopefully you are all safe and following the precautions. Today I am going to explain about the treatment of squint eye. But before we talk about that, we will know a little bit about the squint and binocular single vision. So let me explain it. The visual axis passes from the fovea through the nodal point of the eye to the point of fixation. In normal binocular single vision, the visual axis of the two eyes intersect at the point of fixation, the image being aligned by the fusion reflex and combined by the binocular responsive cell in the visual cortex to give binocular single vision. Now we will talk about classification of strabismus, which are apparent squint or pseudostrabismus, latent squint or heterophoria, and manifest squint or heterotropia. Now we will learn about the apparent squint or pseudostrabismus. In pseudostrabismus, the visual axis of two eyes intersect at the point of fixation, but the eye seems to have a squint. Pseudostrabismus can classified into two types: pseudoesotropia and pseudoexotropia. Pseudoesotropia describes the condition in which the patient has the illusion of esotropic strabismus despite accurately aligned visual axis. It is the most common type of strabismus. Pseudoexotropia. It describes the condition in which the eye appears to be crossed. The other forms are pseudoexotropia, where the eyes appears to be deviated outward. Our next topic is latent strabismus or heterophoria. It is the condition in which the tendency for the eye is to deviate, but that is prevented by the fusion mechanism for the interest of binocular single vision. But under the condition of stress or when the fusion is interrupted, the deviation becomes manifest. Types of heterophoria or latent strabismus. Number 1, esophoria. It is the tendency of the eyeball to deviate inwards. Number 2, exophoria or latent divergent squint is the tendency of the eyeball to deviate outward. Number 3, hyperphoria is the tendency of the eyeball to deviate upward. Number 4, hypophoria is the tendency of the eyeball to deviate downward. And number 5, cyclophoria or latent torsional squint is the tendency of the eyeball to rotate around the anteroposterior axis. Our next topic is manifest strabismus, which has been divided into two groups. Number 1, concomitant strabismus. Number 2, non-comitant strabismus. Number 1, comitant strabismus is a type of manifest squint in which the amount of deviation in the squinting eye remains constant in all directions of gaze, and there is no limitation of ocular movement. It includes following types. Convergent squint or esotropia denotes inward direction of one eye, and it is most common type in children. It can be unilateral or alternating squint. Divergent squint. Concomitant divergent squint is characterized by the outward deviation of one eye while the other eye fixates. Vertical squint. In vertical squint, where one is upward, other is fixate. Incomitant strabismus is the type of manifest strabismus or heterotropia in which the amount of deviation varies in different direction of gaze. Paralytic squint. Paralytic squint refers to ocular deviation resulting from complete or incomplete paralysis of one or more extraocular muscles. A and V pattern heterotropia. The terms A or V pattern squint are labeled when the amount of squinting eye varies by more than 10 pd or 15 pd respectively between upward and downward gaze. A and V esotropia. In A esotropia, the amount of deviation increases in upward gaze and decreases in downward gaze, and the reverse occurs in V esotropia. A and V exotropia. In A exotropia, the amount of deviation decreases in upward gaze and increases in downward gaze. There are one more type of squint known as restrictive squint. In restrictive strabismus, the extraocular muscle is not paralyzed, but its movement is restricted. Now we will move to our main topic, which is the treatment for squint eye. The inaccommodative squint can be treated with spectacles, but other types can be treated with surgical procedures. The common aim for surgery on extraocular muscle is to correct misalignment to improve appearance and, if possible, to restore the binocular single vision. Three main types of procedures are: number 1, the strengthening procedure to enhance the pull of a muscle. Number 2, weakening procedure to decrease the effective strength of action of a muscle. Number 3, vector adjustment procedure that have the primary aim altering the direction of muscle action. The strengthening procedure. In this procedure, the muscle exposed as for resection, and the amount to be resected is measured with calipers and marked. The two absorbable sutures are passed through the outer quarter of muscle at the marked site. The muscle tendon is disinserted from the sclera, and the portion of the muscle anterior to the suture is excised. The muscle stump is sutured with sclera at the original site, and conjunctival flap is sutured back. Weakening procedure. Muscle is exposed by reflecting a flap of overlying conjunctiva and Tennant's capsule. Two vitreal sutures are passed through the outer quarter of the muscle tendon near the insertion. The muscle tendon is disinserted from sclera with the help of tenotomy scissor. This is future optometrist Eqra Fatima, proud to be a part of this optometric fraternity as well as a proudly dedicated executive member of optography. If you are new here, don't forget to subscribe and press the bell icon of this educational channel. And if you have any queries, please feel free to share in the comment section. Thank you everyone.